Hi, my name is Dr. Ryan Sinclair, and I'm going to talk to you today about public health leadership. I'm using the Rowitz textbook, Chapter 11, as a guide for this presentation. You can use this presentation as a note-taking guide. You could also use this as a summary of some salient points from the textbook. You should devote the time required to read the actual chapter. So, public health leadership has changed over the last few decades and now has to respond to a new set of health trends. Alvin Toffler claimed in the 1990s that there are three waves of change in our society. We are supposedly in the third wave of change called the information age. This wave is said to be followed by the fourth wave, where organizations will be strongly oriented towards service and there will be collaborative systems where power is shared by everyone. These were influential theories for the mid 1990s politicians who thought that our current government is tied to the industrialism of the past and needs to change for the future. This was promoted by Newt Gingrich, who liked the idealism of future public private partnerships. He liked it because it leads to an increasingly decentralized government. Just as this theory goes, the chapter promotes the idea that privatization of public health will be prevalent in the future. The public's health will be viewed as the community's business and not the responsibility of the government. Does this sound familiar? We have been having this discussion since Obamacare was initiated 5 or so years ago. Roughly, you could say that the Republicans want to decentralize health responsibilities of the government, while the Democrats are trying to keep it as a role and responsibility. It's not that simple, and there are several components to healthcare in the private sector that were not present a decade ago. In any case, the movement toward the so called fourth wave has catalyzed an emphasis on quantitative forecasting. Forecasting means to make predictions of the future. Statisticians can now look at historical trends to determine the likelihood of certain events happening in the future. We can now make better policy decisions because we can study the community's past from a systems perspective and forecast likely events that would happen in the future. In line with a decentralized public health service, we as public health experts often have to partner with the community. To truly advocate for them, we need to build their capacity and allow them to be given equal authority that matches the new responsibilities and capacity that we hand off to them. We as public health leaders should cultivate this capacity building, but we need to remember that we still have the responsibility to give feedback to them. Public health leaders should become members of community partners and their constituents. This mentoring of the community is also a necessity for personal empowerment of leaders. You may have heard me say the word partnership, collaboration, and constituent. As we study leadership, these vocabulary words become more important. There are four types of collaboration that the book talks about. You may also hear the word cooperation, but that implies a much looser arrangement that we will not discuss. The continuum of collaboration implies that there are different levels of organization for different types of collaboration. An internal collaboration is usually called a team, and the team makes use of the chair or committee to guide their process. The McDonald's fast food chain, for example, uses the term team leader for their general managers. Anyone who is on the team is someone who is required to perform according to what the team leader says. The team leader is also known as the supervisor or the boss. Public health leaders and their advocacy efforts often work with external collaborators who are outside of their organization. A coalition is a method to bring together leaders and brainstorm solutions or ideas. There's no shared commitment, budget, or shared responsibility. An example to this Dr. Rhonda Spencer and I are currently a member of a steering committee with the local South Coast Air Quality Management District. We were hoping that the steering committee would have more shared responsibilities so we could have research projects funded or continue our community interventions in the area. There is no money involved, and the steering committee is mostly a collection of stakeholders to guide a process without specific commitments. When the term steering committee is used, it could mean any of the above types of collaboration. It could be a coalition, it could be an alliance, or a partnership. An alliance is a collaboration that addresses some key public health problems. Collaborators will share information, share resources, and responsibilities. This is the first type of collaboration that actually creates a resource dependency. The next one up is a partnership. A partnership is a collaboration that has everything an alliance has, plus an agreement of specific goals and plans of action. It is the highest level of collaboration as far as organization goes. Here's the figure 11.3 from the Rowitz book. It shows the continuum of collaboration ranked by the organization model. The partnership is on the far right. Look at this figure and think about what are some of the collaborations that you experience in your life. How is your church organized? How is your workplace organized? Consider the coalitions from the homeless that you have studied. Are they truly coalitions, alliances, or partnerships? Also, what does the housing first example require for a collaboration? Can a city adopt this housing first philosophy with a weak organizational structure? That's all I have for you right now. The next lecture will be on mission and vision.